Welcome, medical students, to today's cardiology lecture on the topic of mitral stenosis. Mitral stenosis refers to a narrowing of the mitral valve opening, which can lead to impaired blood flow from the left atrium to the left ventricle. In this lecture, we will explore various aspects of mitral stenosis, including its pathophysiology, etiology, clinical presentation, diagnostic methods, treatment options, and associated complications. By the end of this lecture, you will have a comprehensive understanding of mitral stenosis and its management. So, let's delve into the intricacies of this complex heart condition. Rheumatic heart disease develops from untreated streptococcal infections and leads to mitral stenosis. Pathophysiological mechanisms such as fibrosis, commissural fusion, and calcification of the valve leaflets contribute to valve deformity and obstruction. Mitral stenosis severity varies based on individual factors. Congenital causes of mitral stenosis, such as parachute mitral valve, supravalvular mitral ring, and core triatriatum, although rare, can lead to the development of this condition. These anomalies should be considered in younger patients with mitral stenosis, particularly those with atypical presentations or early onset cardiovascular symptoms. Infective endocarditis, E, is a serious complication of mitral stenosis and a condition that warrants special attention. Patients with mitral stenosis carry an increased risk of developing E due to the altered flow dynamics caused by the narrowed valve orifice. The presence of stagnant blood flow and turbulent jets created by the stenotic valve increase the likelihood of bacterial adherence and subsequent infection. Diagnosing E in patients with mitral stenosis can be challenging due to the overlap of symptoms and signs between the two conditions. Moreover, complications such as valve ring abscess, chordal rupture, and septic emboli can further complicate the clinical presentation. Efforts should be made to recognize and promptly manage E in mitral stenosis patients. This includes obtaining blood cultures, echocardiography for visualization of vegetations or abscesses, and initiating appropriate antibiotic therapy. Surgical intervention may be necessary in cases of severe valve destruction or refractory infections. Severe mitral stenosis significantly affects cardiac hemodynamics, resulting in various physiological alterations. As the mitral valve becomes more occluded, blood flow from the left atrium to the left ventricle is impeded, leading to elevated left atrial pressures. The pressure gradients across the mitral valve increase in proportion to the severity of stenosis. This can result in elevated pulmonary venous pressures, leading to pulmonary congestion and dyspnea. Over time, pulmonary hypertension may develop, further contributing to right-sided heart failure and reducing forward cardiac output. Additionally, the reduction in left ventricular preload due to impaired filling of the left ventricle compromises stroke volume and cardiac output. To compensate, the left ventricle undergoes remodeling, with increased wall thickness and decreased chamber dimensions. Such compensatory mechanisms aim to maintain cardiac function despite the obstructed mitral valve, but they can only partially compensate, resulting in eventual decompensation if left untreated. Overall, echocardiography is a valuable tool for assessing mitral stenosis, providing important information on valve morphology, severity of stenosis, associated abnormalities, and guiding treatment decisions. The use of transesophageal echocardiogram, TE, in mitral stenosis evaluation provides detailed images of the heart and its structures, helping to detect complications. It is important to use TE in appropriate situations, considering its potential risks. Percutaneous balloon valvuloplasty, PBV, is a less invasive treatment for mitral stenosis. Suitable candidates have pliable valve leaflets and meet criteria such as symptoms and hemodynamic parameters. Outcomes are generally positive, but durability may be limited, and complications can occur. Close monitoring is necessary. In the management of mitral stenosis, choosing between mitral valve repair and replacement is crucial. Repair preserves the native valve, while replacement involves removing it and using a prosthetic valve. Factors like valve morphology and comorbidities help determine the best approach. When mitral valve replacement becomes necessary in patients with mitral stenosis, different types of valves can be used, including mechanical and biological valves. The choice depends on factors such as the patient's age, lifestyle, comorbidities, and the risks and benefits of each type. Mechanical valves are made of durable materials but require lifelong anticoagulation therapy, while biological valves do not require anticoagulation but have a limited lifespan. The selection process involves personalized discussions between the patient, surgeon, and heart team to make informed decisions. Mitral stenosis in pregnancy poses challenges due to increased cardiovascular demands. Close monitoring and management are required. Hemodynamic changes can worsen symptoms. Timely intervention may be necessary to balance risks. Multidisciplinary approach is crucial for successful outcomes. Left atrial thrombus formation is a concern in mitral stenosis due to disrupted blood flow patterns and stagnant blood in the left atrium. This increases the risk of stroke. Factors like severity of stenosis and atrial fibrillation contribute. Anticoagulation therapy is crucial for prevention. This section discusses the controversies and guidelines regarding antibiotic prophylaxis for preventing infective endocarditis in patients with mitral stenosis. It emphasizes the importance of individualized decision-making and staying updated with the latest recommendations, with lower risk and comparable outcomes. However, careful patient selection and follow-up are essential to achieve optimal results. Ongoing research and advancements in interventions hold promise for further improving outcomes in mitral stenosis treatment.